Good morning, my name is Rob Hale. I'm the Senior Infrastructure Manager for Novant Health, and I've been working at Novant Health about 8.5 years. So Novant Health employs today about 27,000 people. I manage the infrastructure systems of Novant Health, which include all of the voice systems and all of the networking systems for Novant Health, servicing all 700 locations and 15 acutes. 6 years ago, we were experiencing situations of probably a 5% downtime per year, which is totally unacceptable in an acute environment. We worked with Converge1 to bring in Ribbon Communications, who was able to meet the demands of our zero downtime policies for the hospital systems. Ribbon Communications has specific devices that help us in the acute facility locations. This includes solving all of our analog and digital and voice over IP technology systems. We're actually able to not have to forklift everything all at one time. We could do it at our own pace and bring in the technologies that we needed when we needed to bring them in, and still allows us to keep the patient environment secure and safe. Today, in the last 7 years, we've experienced zero downtime and looking at 100% uptime across the board, including upgrades. So whenever we do an upgrade, it's a zero downtime as well. At the present time, we're collapsing 167 phone systems into one phone system. With Converge1, I've got a single point of reference partner that I can deal with on a regular basis who understands our environment and is able to deliver quotes back to us in an effective time frame so that we can meet our business deliverables. Working with them and partnering with them, we've actually developed the infrastructure build of what we have today, including the C20 or 2100 architecture. In the end, we decided on an architecture and a review team that helps us build the existing infrastructure that we have in place today. So we still have a heavy analog environment as well as some digital phones, and our conversion and our evolution to SIP takes some period of time. It's very difficult for organizations to come up with capital funding for the complete replacement of 57,000 phones at one time. The poly phones that we deployed today were part of an evaluation that we did earlier for all of the SIP portfolios that are out there today. The decision on the poly phones where they met all of the SIP requirements that we had for deployment, as well as the cost structure that we had and the ability to deploy them within our environment whenever we needed to. Ribbon Communications has helped us to eliminate downtime within our environment and always have the capability to communicate with both our patients and our interns and physicians within our practices.